Hi students, hope you have done well in the recently concluded INI-CET November 2024. So here from the Manipal MedAce team, we bring you a rapid recall from each of the subjects. And I am your subject expert, Dr. Vinay, in subject of psychiatry. So surprisingly, there were less questions in this INI-CET, which is not typical of INI-CET. That's what many of the candidates who appeared for the exams uh, gave their opinion as. Okay, still, it's worthwhile to remember that it may not be the same kind of a trend that is followed because previously we had more questions from the smaller subjects like psychiatry, dermatology, radiology, and all. So expecting that it would change every time, maybe that it's worthwhile to prepare well. And so this time, uh, the only question was about substance abuse and also integrating with psychopharmacology. Okay, so these are the eye yielding topics in the psychiatry, and hence it's every candidate must actually go through this topics in detail. Okay, the question was like this: uh, match the following. So, in the one side of the column, the conditions were delirium tremens, smoking cessation, opioid overdose, and alcohol de-addiction. So, other side, the for the matching, naloxone, oxazepam, acamprosate, and varenicline. Okay. So here, delirium tremens and alcohol de-addiction. So both this are related to alcohol use disorders. Okay, this is related to tobacco use, and this is opioid. So here for the delirium tremens, it is the benzodiazepines we use as a part of detoxification. Hence, it is oxazepam. Okay, with related to alcohol de-addiction as a long-term management. Okay, so we use anti-craving agents like acamprosate. Okay, so that is the right answer here. Then when it comes to smoking cessation, the acetylcholine receptor agonist, which is varenicline, is the right answer. And when it comes to opioid overdosage, it is the naloxone. Okay, so remember, for the maintenance therapy of opioid dependence, it is naltrexone and methadone. Okay, so when it comes to overdosage, it is the antagonist which is used, that is naloxone. Okay, so hence, given that delirium tremens it is oxazepam, smoking cessation is it is varenicline, for opioid overdosage it is naloxone, and alcohol de-addiction it is acamprosate. B is the right answer. Okay, so we'll just spend some time here recapping this alcohol dependence here. So remember, alcohol dependence involves acute treatment and long-term treatment. Okay, here it is called as detoxification, wherein benzodiazepines, vitamin supplements are used, and in long-term management, it is either anti-craving agents or aversive agents. Okay, in the anti-craving agents, you have acamprosate, you have valproate, you have ondansetron, okay, baclofen, even SSRIs are used. Okay, while in aversive agents, one you must be knowing, disulfiram. Okay, so with regard to opioid dependence, remember these two. For the overdosage, it is the antagonist which is used, that is naloxone. Okay, for the maintenance therapy, so use methadone, buprenorphine. Okay, so these are the things that you need to remember with regard to at least the major disorders, alcohol and opioid dependence. Of course, in the tobacco dependence, you have nicotine replacement therapy and then varenicline. Okay, so all the best for you for your results in the INI-CET. See you then.